what type of anesthetic should a patient get and what determines the surgeon's choice. So I think there's actually been a big shift in anesthesia, and that's probably one of the bigger impacts that we've had on the joint replacements. Originally, most of the procedures were done under general anesthesia. And what's changed now is we've been able to transition over to regional anesthesia, which has provided a significant advantage, I think, both to the surgeon and the patient. And in terms of the decision on what to use, that really comes down to a collaboration between the anesthesia folks and us. And it's partly, in some cases, dictated by the system as well, and the systems and protocols that are in place. At our institution, what we try to do typically is spinal or epidural catheter for our patients, with or without an adjuvant anesthetic block. And in certain patients, that's not possible. So certain patients with medical comorbidities or previous history of problems that would preclude regional anesthesia, then we would go with general anesthesia. But that would be our preference. And with that, we like to supplement it with a multimodal pain approach. So starting preoperatively all the way through the phase of care postoperatively.